All right, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment, and you can see the shaver there. This has suction attached to it, so we're using this also to flush the knee out. And you can see there's some little small pieces in the knee, but more importantly right now what we're looking at is the femoral condyle up above, and you can see some of the wear and tear changes in the cartilage. And all we're really trying to do right now is make sure there's nothing really loose. Okay, and so now we're going to look, hold the camera for a second there. We're going to look more in the posterior horn of this medial meniscus here. It's going to be right back in this region here. You can see maybe a little bit of a tear there. Actually, it doesn't look too bad. Sometimes suction tells us if it's torn or not, if it comes to the shaver. And then we know it might be loose, but that so far looks pretty good. Certainly no more than some minimal radial tearing here on the medial side. So I think that's pretty good there. Okay, so now we're going to stop and look in the central part of the knee where the cruciate ligaments are. Okay, so this is the anterior cruciate ligament running up towards the lateral side here. That looks great. The posterior cruciate ligament is going to be back over here behind the shaver, behind some of this soft tissue here. And those two structures look pretty good. Those two ligaments, especially the ACL, looks big and strong. Okay, so now we're going to look in the lateral compartment, which is where we think we're going to find some more meniscal tearing. We'll show you that in just a minute. Okay, so we are in the lateral compartment now. We can see this complex meniscal tear here. The articular surface on the femoral condyle is not in great shape either, but right now we're just starting on the meniscal tear in the anterior horn so that we can see how far around posteriorly this extends. Now, whatever we can get easily with the suction and the shaver, we will, but we usually use a pair of scissors also just to help. So that's a pretty good shot of the kind of the body of the meniscus. And here you can see how this tearing extends all the way back posterior now. And then way in the back, we can see this is really a complex tear. You can see these multiple layers. So we'll keep working here. We'll show you some more in a little bit. Okay, we're just finishing up, trying to save as much of the body and anterior horn of the lateral meniscus as we can here. The posterior horn, posterior to the popliteal hiatus, was so torn that there really wasn't anything to save because it was torn all the way back to the root. You can kind of see there what we had to do. And now here we're just making sure this edge of the meniscus is stable. Okay, so we're done in this lateral compartment. We're going to look up at the patella now and see if there's anything to worry about here. Okay, keep the knee pointing up like that. There's your patella at the top of the screen. We'll put our shaver in. And you've got some thinning of the cartilage here, not unexpected given the other areas of the knee that show the same changes. And a little bit on the trochlea down here as well. So that's going to be the end of the story, I think, here as far as this part of the surgery. There's not really much more to do here. I don't see anything else really loose to worry about. So that's good news. Okay, so we're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.